As we celebrate India's 76th Republic Day, Team EPEC acknowledges the nation's journey towards a healthier tomorrow. Today, we are joined by someone who has been a cornerstone in India's fight against some of the most challenging public health crises, Dr. Raman Gangakhedkar, a Padma Shri awardee and a renowned epidemiologist currently working as a distinguished professor at Symbiosis International. He has spent decades leading groundbreaking research in communicable diseases such as HIV, AIDS, and COVID 19. Dr. Gangakhedkar is not only a scientist but also a compassionate leader, tirelessly working to empower patients and communities. As we celebrate the spirit of our republic, let us draw inspiration from his journey, a story of perseverance, purpose, and an unwavering commitment to the greater good. So my first question to you would be like, what motivated you to pursue public health, and like, how has your journey shaped your perspective on the overall healthcare of India?
it was I was a pediatrician when I started, so I was a clinical person.
Okay.
But at the same time, there is, when you enter into research, one of the things that happens is these days we speak of it as translational research. Research is one, if you understand, if I start treating patients, I would treat only one or two as they come. But when it comes to research and when you try to apply those findings, you are actually indirectly treating millions of people with that disease differently. And that realization comes in research very quickly. Unless whatever you do gets translated into action, the utility of whatever you are doing is going to be less. And your ability, since you are able to transfer this knowledge and ensure that the strategies are modified, your contribution to people's health becomes very high. And that's how I entered.
Okay. Were you interested in health-related sector, medicine sectors from the beginning, from the childhood, or did it develop eventually until your adolescence?
That's little tough to say because my father was in revenue services.
Okay.
And I wanted to, because it's generally when you are young, no, you want to follow the footsteps of your parents. So
Yes.
I wanted to join revenue service,
Okay.
but I was too junior in
Mhm.
SSC. My age was 13 years 6 months
Okay.
when I appeared for the exam. But my parents insisted that you should join medicine,
Mhm.
and that's how. Then after that, I did not look back. I thought we are into it, and I have to do my best. That's how I entered. One of the things that happened further, like if the last question that you had asked, was I had an opportunity to go to Johns Hopkins University, which is number one university in the world in terms of whether it's clinical medicine or public health or whatever.
Yes.
And there I did my master's in public health.
Okay.
And that made me understand the research and translational aspects little better. And I continued on those lines.
Okay. Okay. So it was an eventual thing, like you wanted to serve the nation through public services. So health was a very good option.
That
That's
was
good.
always there. In
Okay.
19, I used to be working on AIDS,
Mhm.
HIV disease. In 1991, from Geneva, a team had come from Global Program on AIDS.
Okay.
And they asked me, that time the issue was smaller, fear was larger that it is going to spread.
Mhm.
People working in that area used to be less. So I was asked a question, why don't you join Geneva team
Yes.
so that we'll be able to do better? But I told them that I'm not cut out to help other countries first.
Mm.
I have to first improve my own country. What is the point in me going there? I will earn more money, no doubt about it. I will be able to help larger number of people. But the reality is my country needs me. If I
Yes.
am able to overcome that part, then I am free to work out anywhere.
That is good to hear, sir. That is good to hear. Everyone should have that spirit to serve the nation. It's very good to hear. So, sir, my next question would be like based on your work with the Nipah virus and COVID-19 recently. So, how do you assess India's preparedness for emerging infectious diseases? Like recently, also we've heard that a new disease is about to spread, and it has hit some parts of India. So, what do you think India should do as a measure to prevent these? And is India ready for it now?
Now we are perhaps far better than we were ever, in the past. One of the reasons in 2018, Indian Council of Medical Research decided that I should move from Pune to Delhi to head the Division of Epidemiology and Communicable Diseases. Within 5 months of my my taking over that post, Nipah occurred.
Okay.
Nipah was a major challenge. Major challenge in the sense the mortality rates or case fatality rate, as we actually call,
Mhm.
if there are 100 people who get that infection, almost 90 were dying in Kerala. No?
Okay.
That's a frequency that I'm talking about. And in Kerala, when it occurred, the bigger surprise was so far we knew in the past this infection was occurring somewhere around West Bengal and Bangladesh border. It never came to this side of the country. So there was a shock. There was a fear that perhaps this could be used as a agent of bioterrorism because there are certain underground, what would I call, underground people
Underground elements
there
like
in
who
Kerala
induce.
as well. There was a fear that perhaps it is done purposefully.
Uh,
It gave us only 15 days time. But in
okay.
the 15 days, we could manage it comprehensively across and also establish what is called as One Health surveillance. No?
Mm-hmm.
One Health surveillance is even pigs are under surveillance, the bats surveillance, everything was being done. And since I come from HIV background, there is one understanding that we have. Technology can make huge changes, but community acceptance, the community's willingness to use and mobilizing the community to use it rightly is the critical factor. Otherwise, it has no value. So
Yes.
in HIV, we have without a vaccine, without a cure, today HIV disease is no longer a major threat. We
Right.
talk of it as one chronic persistent viral infection, which will perhaps be eliminated by
Mm-hmm.
2030.
Mm-hmm.
This has never happened in the past so easily because either you have to have a vaccine or a cure for such
Mm-hmm.
disease. So one thing which I realized was community mobilization would be an extremely important activity. So we trained all the stakeholders in Kerala after the first episode in 2018. And it was not only private hospitals and public hospitals, but even community was being trained through peers.
Mm-hmm.
The result was exactly 1 year later, because
Mm-hmm.
these bats tend to come at a time when fruits are ripe
Right.
and mango season is on always in the month of May in Kerala. So exactly 1 year later, the next episode was reported. This actually came from a private sector hospital, and they managed to send that patient within a day's time to one of those medical colleges where the patient could be managed. This was an engineering student who incidentally was infected.
Mm-hmm.
This time we could ensure not only that the patient survived,
Mm-hmm.
but also the fact that it did not spread across.
Right.
Now these findings gave us an experience which was extremely useful when COVID started.
Right.
During COVID time, at least we had an understanding how to handle a potentially rapidly spreading infection which perhaps has a very high case fatality rate. COVID
Hmm.
had very little.
Yes.
And that experience helped us a lot. One thing which is a major outcome with respect to pandemic preparedness now is now, see, when we started with vaccines, we had no choice but to use Covaxin first or
Hmm.
import Covaxin because we had only one vaccine development platform, that is whole inactivated vaccine development, which
Okay.
was something which we could have done
Hmm.
at that juncture. Rest of the viral platforms were not there. Now, second thing we did was we talked across to Oxford, and Oxford group actually wanted a manufacturing base from India because this was an issue where everyone had to be given the vaccine.
Hmm.
So there has to be a large capacity of production which should be available to people. So what they did was they were willing to partner. We insisted that there should be technology transfer so that when technology transfer will come, even adenovirus based vaccines would be can be manufactured in India. And that was what Covishield was, another vaccine which would produce that. What is important is now India has ensured that every type of vaccine development platform is currently available. There are more than 10 different technology platforms that are available across the world. Now we have everything. Same is true with any new drug development program.
Hmm.
You need to have drug development platforms always ready to fight against any infection.
Hmm.
So the result is today we are extremely balanced. You won't require,
Sorry.
you will not require longer period as we had to spend during COVID times. Though for every other disease, if you think about, yeah, we took far lesser time compared to other diseases.
Hmm.
We are far more prepared, in terms of any respiratory pathogen that comes in. Because you have to remember at that time, we had nothing left but to go for lockdown.
Yeah.
We knew we did not have sufficient numbers of masks.
Hmm.
We did not have neither N95 or simple surgical mask.
Hmm.
The quantity that India would require for disinfectants, even that
Yes.
was not there.
Hmm.
You think in terms of fighting against an infection
Yeah.
through your healthcare workers, and healthcare workers don't have PPEs, the gown like thing that you have seen.
Yeah. Yeah. Yeah.
No mask, nothing, no. Now, how do you fight against such an infection? So, we had to go for lockdown. Worse still, if we were to provide, let's say, even paracetamol tablet for
Hmm.
fever to everybody in the country for an episode for fever, we didn't have that capacity.
Hmm.
So there was no other option than going ahead for lockdown. Lockdown was also a play time when we had to look at even vaccine development. When vaccines were to be administered to, let's say, 135 crore people,
Hmm.
you need to have that many pieces of syringes and needles.
Yes.
Those are not, they were not available. We didn't have capacity. But everybody supported, all pharma industry, the vaccine manufacturers, the textile industry, the companies that manufacture reagents.
Hmm.
Everybody came forward, increased their capacity, and those many quantities were available for people to be utilized then by the end of lockdown.
Yes.
So basically, we are today having a large capacity in the industry. We have the largest manufacturers of vaccines that are available here. We have every development platform, and now there are many what we call as BSL 3 laboratories, biosafety 3 laboratories.
Uh-huh.
The organism is extremely dangerous The fear is if it gets easily transmitted, lab technicians or somebody who wants to diagnose may get affected.
Hmm.
So they are isolated in certain facilities which are extremely high level facilities for biosafety. Even those numbers were small. We did not have even sites where diagnosis could take place. See, you can stop people from passing infection only if you know who is infected. So
Yes.
you should be able to diagnose that. And there was only one lab in the month of January,
Hmm.
30th of January in 2020.
Uh,
It was National Institute of Virology, which
okay.
was actually doing this test. And the basic thing that you have to do is RT-PCR. Now, this RT-PCR facility was available in our VRDLs, Virus Research Diagnostic Labs. The number was only 35. Now, with 35 laboratories, how do you provide access to people? Because they need access at their closest possible place. So
Right.
we had to use technology,
Hmm.
train everybody. No, and how do you do that? You do it virtually, because
Hmm.
lockdown was on. You cannot bring them here. No, so these people were trained. You look at ventilators.
Hmm.
Ventilators. When it came to ventilators, you must remember that we did not have sufficient number of ventilators.
Yes.
Every country was fighting for ventilators.
Yeah.
But one of the issues was either we survive by asking the industry to support and with their own indigenous ventilators.
Hmm.
That's how ventilators came. But it's easy, to buy even from your own industry,
Hmm.
which may develop. No, let's say they took almost a month's time
Hmm.
develop these ventilators. But the issue is you should train people how to use ventilators because they
Hmm.
were not used to doing that. That was also done using telemedicine.
Hmm.
Now that's something which one has to remember. We train large number of people at any given point in time. Now you have everything, but
Hmm.
then the major challenge was how do you distribute it?
Exactly. Yes.
Because you have lockdown, no
Yes.
transportation, nothing. So we used to have, we used almost every kind of air facility that
Hmm.
from either private airlines whom you lease
Hmm.
or you use the cargo flights
Hmm.
of Indian Air Force.
Hmm.
So it was a massive kind of an operation, which perhaps one cannot imagine. But now that we know how we have to fight, today we have made a difference.
Hmm.
Today, if you actually look at the efforts are being made to develop this One Health surveillance strongly right now. We have now National Institute for One Health, which
Hmm.
is established in Nagpur. You actually look at, every district level. Earlier, we did not have a infectious disease block.
Hmm.
No ventilators were available. Today, all of them are trained. Today, if you actually look at even provision of oxygen at district level was a difficult task, looking at the numbers that were coming. At that time, I recall in the first phase, we found in the first wave that the only way to fight will be because we were running short of medical oxygen.
Hmm.
So we had to request the steel industry, which has industrial oxygen,
Yeah.
to allow us to use their oxygen,
Okay.
converting it into usable oxygen for human beings.
Right. 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 Yes.
It was, as I said, it is something which was extremely massive.
Uh,
Within 6 months of our initiation of the process in January, we had close to about over 3,000 laboratories that were there across. They were doing RT-PCRs, but then the new issue comes. No, these machines can do X amount of testing.
hmm.
Our population is high in metropolitan cities.
Hmm.
We had to actually get machines which were there were only two machines which were available
Hmm.
in the world which could test 10,000 samples a day.
Hmm.
So we had to request US government get those two, buy those two and bring them in India.
Hmm.
If you look at those RT-PCR machines when we started, when we asked the companies, there were only 28 machines that were available in India.
Hmm.
Now you look at the number of laboratories that we were planning and where we have reached. So it was a massive effort.
Hmm.
All stakeholders had to act well. You look at even from IT sector point of view, in no part of the world you had a system whereby once you receive a vaccine, you'll get your certificate on the next minute. No, it will come on your own mobile, unheard of in country like India. And it was done across the country and seamlessly it was occurring. So basically, we have shown that we can do it, and with the experience, now we are establishing everything in such a strong manner that hopefully, if anything comes, we will be in a better position to handle that.
Definitely, sir. Definitely. It's a very good story to hear, like how we tackled the logistical, because no one would be able to guess the logistical amount of pressure that, because the medical pressure was obviously there, but logistical one also is.
It was massive because you have to remember our pharma industry
Mm.
depends very heavily on Chinese
Yes.
API and key starting
Mm.
materials. China had closed down within a month's time.
Exactly.
So there were no flights going to China. There were no ships going to China.
Mm.
How do you survive?
Exactly. Yeah.
And you had to. But as I said, everybody played a sterling role. No, they never hesitated. They stepped up ahead. And is that easy to do? No. You have to remember that in a
Yes.
country like us, when you have a lockdown, no, if you want to even ask an industry to produce something, how is he going to get his workers? No, where are they going to eat food?
Mm.
There are no buses across. So
Yes.
all those issues had to be handled. Otherwise, nothing would have had happened in this country. No,
True.
it
True.
was a massive operation from operational angle. Scientifically, also we have done very well. we
Yes.
have uh, we have bigger achievements than we generally hear of. So I believe now we are on a stronger footing, but there is one thing which is missing now. Now, if
Okay.
you actually see, we learned certain good things in the pandemic.
Right.
No? One was hand hygiene,
Yes.
and second was use of mask to
Mm.
prevent the risk of transmission as well as acquisition. The moment people started hearing that Omicron is not
Yeah.
going to kill, no, it is unlikely to be a fatal illness, people started dropping the use of mask.
Uh,
We had so many casualties. We have seen the worst during Delta wave.
mm.
But has the community understood the importance of mask, importance of hand hygiene? In that period, the acute respiratory infections had dropped down
Right.
beyond COVID.
Mm.
You actually look at diarrhea that used to occur, there were far too few incidents of diarrhea, and that was mainly because you are using mask and
Right.
also hand hygiene.
Yes.
But people have given up. Though we managed to mobilize the community,
Mm.
I think it is time. No, people have to reflect and think that at least when I'm sick, if I have, let's say, a viral infection, cough
Mm.
and cold, at least I should wear mask so that others don't get it. No, your own
Right.
family will be protected from it. But we have forgotten, and that is not only in COVID. This happened across. No, if you look at SARS, if you look at MERS,
Mm.
people change, but change for a short period of
Short
time.
period of time. Yes.
The only thing that we could achieve importantly was, which is sustained to my mind, that people earlier used to believe that when you become sick, so they used to give all kinds of reasons. Na, ice cream khaya,
Ha.
looking at me, my God wanted to punish me, and all kinds of things. No? But today they have understood the concept of infection,
Yes.
that there
Mm.
are germs, but we have to build on it. no,
Yes.
and not let this opportunity be wasted, because that would be a bad loss. We have to move on better health literacy and sound science literacy for
Hmm.
the population. Only then this will be sustainable improvement that you will see.
Indeed, sir. Indeed. So my next question would be like, how did it feel to receive the Padma Shri in 2020, and like how did you feel after getting the recognition after doing so much of work for the country during such a heavy time? So how did it feel?
No, let me tell you the truth. No, I received Padma Shri on 26th of January 2020.
Yes.
Right, that time COVID was just beginning.
Ah.
I had received it all for my work that I had done on HIV disease, or AIDS as you call generally.
Right.
What was best was, you asked me some question before I forgot. One of the things was, I must share that I never applied for Padma Shri.
Okay.
It was the HIV infected people, their associations, sex workers associations, Hijada groups associations, MSM associations, men having sex with men's association. They suddenly decided that this person has done so much for us.
Hmm.
We want to see that he receives Padma Shri. That was a community recognition, and that was for AIDS. Now, when you receive this, interestingly, I heard only on 25th January
Hmm.
that I have received it. Actually, government support was also there because of Nipah and Zika, which I
Hmm.
had managed successfully. But on 25th, when they declare, no, one day before the Republic Day, they declare the names. When they declared those names, people started calling me. But at that juncture, Health Secretary, Dr. Preeti Sudan called sometime at 10 o'clock.
Okay.
And she was a very nice person. She said, डॉक्टर साहब, मुझे बहुत बुरा लगता है, आज आपका दिन है खुशी का, लेकिन वो 4 सैंपल जयपुर से आने वाले थे, वो एनआईवी को अभी तक पहुंचे ही नहीं है. I was constantly on phone on this side, and at the same time I had to handle that matter.
Yes.
Now, was that, to me, it was a gift from God
Hmm.
that I could work at that time at that particular position. What was so good about it? I was never a press man.
Hmm.
No, I never used to be giving as many press conferences. But they asked me to sit on those press conferences every day, because there was a Supreme Court oral order
Hmm.
that the country needs to know every day what is happening about the pandemic.
Yeah.
You must hold a press conference for the until the time the reporters are exhausted with the question. So there was no time limit. No. Now, what was scary, for a person like me, when you're not used to handling press,
Hmm.
so the fear used to be everybody in the country was looking, hearing or seeing those press conferences. One small mistake in terms of use of word or
Hmm.
anything wrong you do, the entire country would have done whatever it comes to their mind.
Yeah.
I used to be so scared of speaking, because my worry used to be that ours is a very democratic country.
Hmm.
So the moment you will say tomorrow, there, can we give holiday to your college?
Hmm.
There will be 50 people who will say yes, 50 will say no, 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 it should not be given. And then you become responsible for
Hmm.
what happens there. But fortunately for me, everybody supported, not only the people, the government, the reporters. There were no nasty things written
Hmm.
even after the press briefing that used to occur every day. Even the political parties, all political parties, they never bothered me during that time.
Hmm.
And actually, that was also helpful, because we could plan well, execute well. and ensure that the community listens to whatever we were saying. I think one of the biggest things that I have seen of my life is the multi-sectoral approach of the government.
Right.
The government was extremely vigilant.
Mm.
Within 6 days of the news that China is having a major issue right now, the entire government was after this issue. How would we control? And that was amazing to my mind. And the credit goes to the government as well, to everybody in the government.
Indeed. So, like, sir, my next question would be on Republic Day, how do you view India's progress in public health overall, and where should our focus be in the future? So, there might be some events that you see right now, or maybe see it as a bird's eye view. So, what do you think our focus should be, and where are the areas we should improve?
Yeah. The most important focus, no, see, it's very easy to develop drug, no,
Hmm.
compared to ensuring that people take that medicine. They
Yes,
take it for all days that for which it has been
the
prescribed.
awareness basically.
Yeah. You look at the development of vaccine,
Hmm.
but people should come forward to take the vaccine. Vaccine
Hmm.
hesitancy becomes an issue.
Hmm.
No. Now that we have gone into adult vaccination
Hmm.
and knowing that we will also have elderly population that would be increasing in the next decades or so. So what will essentially happen? You will require adult vaccinations to be provided through the program to elderly people. But the people should actually be willing to take those
Willing
vaccines.
to take,
No?
yes.
Now, second most important thing is we have to emphasize or give priority towards developing community mobilization. It
Hmm.
is time that people should also understand that health is not only the responsibility of the government,
Yes, it
but
is
it
their
is
own
also an
responsibility.
individual responsibility.
Yes.
You are responsible not only for your health, you
Hmm.
are also responsible for your other family members,
Hmm.
your friends, the people who live in the surrounding, and that attitude has to come in as a major issue as of now.
Hmm.
Now, as far as what we should be doing, I think we will have to intensify spending on health. No? Even today, our expenditures on health are far too low
Hmm.
with respect to percent GDPs that we look at.
Okay.
And if that happens, perhaps we will have one of the best public health systems because the other countries suffered a lot. They have good tertiary care hospitals. If you
Okay.
take USA, if you take
Uh-huh.
UK or whatever, whichever country. But you can't be successful only with tertiary investments in tertiary care hospital.
Yes.
Here in our cases, we had to mobilize all the public health infrastructure where even Anganwadi workers,
Hmm.
is the ashas, at the periphery used to actually go see the people, ensure that they are isolated if at all. If there was any provision that we had to give, even that was done. What was also redeeming at that juncture was we had the best combination of tertiary care and primary health care.
Okay.
And I think that emphasis will definitely lead to major changes over a period of time. It is also important that we have to strengthen. There is a paradigm change that has occurred after 2014. You hear a lot about yoga.
Hmm.
Now you suddenly hear about health and wellness.
Yes.
Because if you maintain wellness, your
Yes.
expenditures on tertiary care, which are pretty high, per case, even that can go down a lot. But
Okay.
we have to ensure that everybody understands the importance of
Hmm.
prevention of these issues, and try and ensure that you adhere to what they have been saying. Now, when it comes to yoga, more often than not what happens, people may do yoga after learning, let's say, for a month's time.
Hmm.
But after a month, that's all over.
Yeah.
It's your health. You
Yes.
want to prevent the complications that are likely to arise
Hmm.
because of different exposures that you have in life. So there are many good things that we can do, and I'm sure with the government, that this is likely to happen, because for the first time, health received huge visibility and primacy, and people started wondering earlier. Any intervention in health, nobody used to recognize them.
Hmm.
Nobody used to feel, "Acha, this is a good thing." But today it has happened. We have a base. Now we have to build a good house on it.
Indeed. And so, what about the so what should be the future focus on in terms of public health? Like you told us that what are the problems right now? So how do you view them? Right? How long will it take, according to you, to increase that awareness to a point that, as you mentioned, the tertiary hospitals, at a point that they are very low budget and they are not almost not needed. So how long do you think the timeline should be for that? What should we aim for?
Now, I think the future challenges are going to be little different.
Hmm.
So we may have to position with different strategies for handling these future challenges well.
Yes.
Now, one of the areas that is going to come up very strongly is mental health.
Indeed. Yes.
Yeah. And with AI that will come around, when people will not get jobs
Yeah.
routinely, the mental health issues are going to be major botheration. There could be increase in suicides, even homicides. You talk of anything, depression would increase, anxiety would increase, poverty is also likely to increase. Now, in those circumstances, we will have to ensure that this program on mental health will have to be relooked and strengthened as much as possible. That's one. The second issue, which is also important to understand, is antimicrobial resistance.
Okay.
So by 2050, it is expected that almost 50% of the deaths that occur in intensive care units will occur because of antimicrobial resistance. Because
Hmm.
people don't use, there is no rational use of antibiotics as it is required. And this is mainly because people demand antibiotics. They want antibiotics to be provided. Doctors are also not averse to saying no to the same, because basically they feel, I will do something which will be useful for the patient without
Hmm.
thinking of those consequences. And this will require the approach across in every sector. To give you an example, all of us know when it comes to fisheries, when it comes to poultry, they use antibiotics like crazy because those
Hmm.
birds should not die. And the result is you are exposed to high amount of antibiotics unnecessarily every day, and antimicrobial resistance could be a major issue that may crop up. And in addition, we must remember lifestyle diseases like
Yes.
non-communicable diseases are going to be high. So the current focus that was more towards infectious diseases has to improve now strongly in these lifestyle communicable, non-communicable diseases and newer areas that are emerging. So how many years would it require? I think as long as human beings are alive, you will require strategies to be modified or changed or even devised new if there are newer diseases that would come. But hopefully, there is a movement that is occurring.
Hmm.
Technology is almost replacing human beings
Hmm.
in every aspect or reducing the efforts that that individual was requiring to do it earlier. So what might happen over a period of time? Over a period of time, perhaps we will go. Everybody in the world will start moving towards welfare states, so that you get adequate amount of food to eat.
Hmm.
Maybe you may not be earning a lot, but the bare necessities are covered. What will also happen at this juncture? People will start reflecting on how their health should be.
Yes,
Because if that happens, perhaps the change will come rapidly.
indeed. So, sir, my last question for this interview would be like, I am an engineering student and VIT Pune is an engineering college. So, how do you view that engineering students are right now at the forefront of technology? What advice would you give them about developing solutions that integrate both engineering and healthcare together? So, what views do you have on this?
No, both, no. Even for social mobilization,
Mm.
we use a term called as social engineering for
Right.
engineers.
Yes, yes.
Because I don't think, no, everybody has a critical role to play.
Mm.
Who, whatever profession you belong to for humanity. And when you say a role to play, it is not only in your discipline, it has to be multidisciplinary kind of approach. Now, their engineers would be required, their health related people would be required to come up with solutions, for critical issues that tend to emerge. Now, if you actually look at artificial intelligence
Mm.
as one tool that is developing, what is important is we have to ensure that it remains ethical. Health and artificial intelligence will never go away. It will come up strongly. But
Mm.
the rate at which the interventions that are being developed in using AI continue to be small. Now, if you actually look at US FDA approved algorithms or devices which are based on artificial intelligence, the number is only around 1,000.
Mm.
Just imagine. When it comes to India, have our software giants, have they made any kind of a difference in health? Only couple of companies, they have developed devices, but rest of them, they are publishing papers like crazy. They are getting employed, they are writing all kinds of algorithms,
Mm.
but our successes are far too few. And that
Indeed.
is only because the health team, is unable to give uh, good data, good quality data. You may write algorithms,
Mm.
but eventually, if your data on which you actually built your machine learning tool, if it is of poor quality, the outputs are going to be poor. No,
Mm.
it is like garbage in, garbage out. No,
Yeah.
and therefore, I think they have to come together to, they should discuss what is a critical problem, and then develop cohorts which are appropriate to try and understand as to how that data would be collected and work over with that data. Now, at this juncture, they are talking of agentic artificial intelligence. No,
Mm.
now, when it comes to agentic, it's going to be as tougher because we would have people's diversity, health diversity for decision making that will come. But we have to remain ethical and move ahead. Now, when
Yes.
it comes to engineering, we will have to find different engineering solutions with respect to climate change. And
Yes.
climate change eventually is going to affect on health. We have
Mhm.
seen one effort through one issue like COVID. It is going to become worse in every other area as well. Now, those solutions are like preventive health related solutions,
Yes.
as to how you will perhaps use them to ensure that health related problems also do not come up, apart from all other issues that tend to arise in the population. Engineering students are extremely important for, even drug discovery as of now.
Mm.
There are different softwares people are developing to shorten the period of duration of identifying a compound which could perhaps work against an X disease. No, so these kinds of algorithms are also becoming important. So essentially, as you will look into health science, you will find that you have too many things to do.
Yeah.
When we think in terms of engineering and we look at those complexities, acha, these people have to have also got a big role to play
Mm.
in our system. It is important to remember unless we work together, solutions are not going to be perfect and available easily.
Yes. Okay, sir. So, thank you so much, sir, for your time today and for sharing your valuable insights with us. We appreciate the lessons you've shared, and we hope to carry forward the spirit of Republic and the service that you demonstrated in your career. And on behalf of the Event Planning and Execution Committee, I'm Aryan Mundra, and I thank you once again for being part of this session. And we wish you continued success in all your future endeavors. Thank you so much, sir.
I would just say one thing.
Yes,
India is our country, one of
yes,
the largest countries in terms of population load. Everybody can actually contribute in small way
hmm.
to develop our country. Please don't think, this is not my responsibility.
Yes,
When it comes to health also, even if you are an engineer, you should reflect, can I spend one day every month for improving health one way or the other of the population? So essentially, this is something which we have to keep at the back of mind. And now the entire mantle of India is on younger shoulders. All of us will disappear one day. And I'm
hmm.
sure people like you will definitely make a difference if you take it very seriously.
Indeed, sir. Yes, we will try our best from our side, sir.
Okay.
Yes, thank you so much, sir.
Thank